Hi, I'm Lynda Wiebenga and I work in the pharmacy department. I'm a pharmacy technician and I've been here for about 20 years, and today I'm working in the emergency department doing medication reconciliation. Okay, so a pharmacy technician is, we work in the pharmacy department. We work alongside pharmacists. Dispensing pills is probably the least of our job. That's a very minor part of it. We do collaborate a lot with the nursing and physicians, and basically just to make sure that the patients are getting their right meds. Today I'm doing medication reconciliation, and it's basically what we call it a BPMH. It's called the best possible medication history, and we really like to get two sources. So the best source is the patient themselves. They know what they're taking, or a family member. So they know what they're taking, they know, they sometimes don't know the names of it or why, but they do know the color, the shape, or whatever. I also try to get a different source, whether it's the retail pharmacy record, and things that they wouldn't take normally every day, like say they get an injection once a month. So what we're trying to do is get the most accurate list. And sometimes the vial will say they're taking it twice a day, but they're not. They're only taking it once a day, whether it's, it upsets their stomach or their doctor told them to reduce it. So the bottle doesn't always indicate exactly how they're taking it. So my job is to make sure that I get a list of the medications, the way they're taking it, and accurately. And then so I will put the list together, and then the physician, the admitting physician, will look over it and see whether or not, they're still appropriate, or should they be put on hold while they're here, things like that. When the patient is ready to go home, we actually will have a look at the meds that they came in on, so their admission orders, and we compare them against their discharge orders. And so then we go talk to the patient, and we want to make sure that the patient knows any changes that have been made to their meds. So we don't want them to go home and continue to take the meds that they came in on and their new meds, especially when things are lots of times, especially if they've been here for a while, there's a lot of changes to their meds. So we just want to make sure that they're clear on what they're to take when they get home. I love the patients. I like the interaction with the patients, the interaction with the nursing staff and the other medical staff, just being out on the floors, and we're not hidden behind a counter most of the time. In a sense too, I'm hoping that I am making a difference, for sure.